Good afternoon. I'm Linda Baker, the Learning Director at the Center for Research and Education on Violence Against Women and Children. On behalf of the Knowledge Hub team, welcome to our research briefing, exploring lessons learned from arts-based HIV and STI prevention programs with Northern and Indigenous adolescents in the Northwest Territories, Canada. Dr. Logie will speak for up to 15 minutes. Please enter comments or questions for the presenter into slido.com and use the code 7423, and that will be displayed on the slides for your reference throughout the presentation. During the last 5 minutes of our research briefing, I will present some of your questions to our presenter for her response. The link to the presentation slides was emailed to you earlier this morning. Now I'm honored to give a brief introduction to our speaker. Dr. Carmen Logie, Canada Research Chair in Global Health Equity and Social Justice with Marginalized Populations, is an Associate Professor at the Faculty of Social Work, University of Toronto, and Adjunct Professor at the United Nations University Institute for Water, Environment, and Health. Her current research focuses on HIV STI prevention, testing and care cascades in Uganda, Jamaica, Brazil, and Canada with people with HIV, refugee and displaced youth, LGBTQ2S+ communities, and Northern and Indigenous youth. Welcome to the research briefing, Carmen.
Thank you so much for having me. So I guess I'll get started. I'd like to acknowledge my co-principal investigator, my colleague, Dr. Candice Liss, who is the executive director and co-founder of FOXY, which is the program we're going to be talking about today, and I'm presenting on her behalf. So we have a very brief amount of time, and I'm going to try to get through some really brief overview of what is FOXY, some of our latest research on FOXY participation and sexual health outcomes, contextual influences we've looked at on sexual health, on mental health, and implications. So stay tuned, we'll be covering a lot in a small amount of time. So what is FOXY? As I mentioned, it stands for Fostering Open Expression Among Youth. It was actually started by Dr. Candice Liss, who's from the Northwest Territories, as a way to respond to and address the needs of sexual health education among adolescents that she herself found were missing growing up as a teen in the Northwest Territories. And there are two main components to FOXY. One are school-based workshops, which is what I'll be presenting about today, but there are also peer leader retreats at a fly-in only lodge that happen every summer where they train peer leaders and go back to learning more about nature, art, crafts. So there's these two very different but connected programs. And I also would like to acknowledge SMASH. SMASH stands for Strengths, Masculinities, and Sexual Health, and is the latest program out of FOXY's umbrella that works with adolescent boys and young men. So the first findings I'm going to present are around outcomes we've looked at associated with participating in FOXY. So the findings I'm going to present on are about school-based workshops with adolescents aged 13 to 18 in 17 Northwest Territories communities. Please note more youth participated in this who are under the age of 13, but our research ethics focuses on those 13 and older, so that's what I'm presenting on. So the school-based workshops include really innovative arts-based approaches, including role plays, body mapping, all these fun activities, games, and there's 7 components and they're held over 1 or 2 days. Participants complete baseline surveys immediately before and after the workshops. And in a survey, we look at sociodemographic variables such as age and ethnicity, HIV and sexually transmitted infection or STI knowledge, and risk perception, sexual relationship power, and safer sex or condom use self-efficacy. So we conducted latent change score models to look at pre and post test differences in these variables before and after the intervention participation. And so we include in this analysis 344 participants. The mean age was 14. About half were men, half were women, 15% identified as lesbian, gay, bisexual, or sexually diverse, and nearly 80% identified as Indigenous. Two-thirds had ever attended a FOXY workshop before. So FOXY goes back to the same communities every year, and sometimes people have the chance to participate more than once. And what we found was significant increases in HIV and STI knowledge comparing before and after the intervention, and significant increases in risk perception, so your understanding of your own risk for HIV and STIs, as well as safer sex self-efficacy. And the largest increase across most of the outcomes was the first time the person participated. So for instance, those who had taken the workshop more times had smaller increases in HIV and STI risk perception and safer sex efficacy. That also suggests there could be some lasting effects of participating in FOXY. For instance, improving HIV risk perception and safer sex efficacy. And because we didn't find significant changes for folks who had taken FOXY before or not taken FOXY before with regards to HIV and STI knowledge, that does suggest that there's a continued need for interventions such as FOXY as a booster to increase knowledge around HIV and STIs. So there's a bit of a delay on switching the slides. Perhaps you can move my slide for me? Thank you. So the next I want to present on is around contextual influences on sexual health. Next slide, please. So we know that the social worlds that we live in shape our sexual health and our vulnerabilities to HIV and other STIs. This is important to look at, particularly in the Northwest Territories, because we know in the Northwest Territories, there's among the highest rates of sexually transmitted infections. And there's also higher rates of sexual and gender-based violence in the Northwest Territories. And food insecurity is listed in the statistics as being 16%, which is nearly double the national prevalence in Canada. And so we apply this social contextual approach to look at what are the pathways from food insecurity, which is a well-known structural risk factor for HIV and STI infection, to condom use efficacy. And we looked at pathways through resilience. So condom use efficacy or safer sex efficacy is a proxy for sexual agency. So the power that you have in sexual relationships. It includes knowledge, intentions, and relationship dynamics for negotiating safer sex. And among youth in the Northwest Territories, we have found among sexually active youth that higher safer sex efficacy is in fact associated with using condoms. Next slide, please. So what we found when we were looking at food insecurity is it was higher among Indigenous than non-Indigenous youth, so 48% versus 34%. And food insecurity was associated with lower resilience, and resilience was associated with condom use efficacy. So you'll be seeing it in the next slide, not yet, but the next slide you'll see a model showing these relationships. So really what we found was for young people who had experienced food insecurity had lower resilience scores, and those lower resilience scores were then associated with decreased sexual, safer sex efficacy. Next slide, please. Now you'll see the beautiful model. So we looked at food insecurity to various dimensions of resilience. You see above there support, social skills, spirituality, as well as we looked at multiple facets of safer sex self-efficacy. For example, knowledge, confidence, and skills about negotiating condom use and how those might change or not change based on using alcohol, who the partner is, for instance. And so we really see here that food insecurity is a really important factor to address when we're thinking about sexual health outcomes. And while we know that a lot among adults, it really hasn't been looked at sufficiently in food insecure contexts such as Northern Canada. Next slide, please. So now I'm going to give you the last few minutes a really brief overview of looking at our mental health analyses. Next slide, please. So I'm sure that you all know that there's mental health disparities in Northern Canada, higher rates of depression and suicide compared to other regions of Canada. So what we found was nearly half of the participants in our study of these adolescents reported having no or minimal depression symptoms, 25% mild symptoms, and 28% moderate or severe depression symptoms. And what was associated with depression symptoms in our multivariable analyses was being a woman compared to other genders, so compared to being a man or being gender diverse, being lesbian, gay, bisexual, queer, so being sexually diverse versus heterosexual, and food insecurity. See the important role the food insecurity is playing in well-being among young people. And those factors I just listed are associated with nearly double the odds of moderate to severe depression. And among those in dating relationships, dating violence was associated with double the odds of moderate to severe depression symptoms. Remember, this is among adolescents. Adolescence is a really important time to promote mental health because mental health issues during adolescence can have lifelong implications. Next slide, please. So this is the implications. I have 3 points for you here. One, arts-based approaches to HIV and STI prevention, such as used by FOXY and SMASH, have the potential to advance HIV and STI prevention. They have the potential to produce lasting benefits by increasing risk perception, safer sex efficacy, and HIV and STI knowledge. These approaches engage youth, they're fun, they're interactive, they're not simply providing information, but they're engaging people in body mapping, role play, and they move just beyond a focus on sexual health to also look at healthy relationships, to look at self-esteem, to look at confidence. Second, if we just focus on HIV and STI prevention, on building individual level resilience, that's likely going to be insufficient when people are living in contexts of food insecurity and other contexts where they have less control and well-being in other areas of their life. And third, when we're thinking about promoting mental health among adolescents in the Northwest Territories, we really need to look at many facets of context. So we need to look at food insecurity, we need to look at dating violence, and we need to look at what is it about gender and sexual orientation norms that are contributing to higher rates of depression among women and among sexually diverse youth. And the last slide is contact information. Feel free to contact me. Check out my website. Check out my website. I meant check out my podcast. You can also check out my website. And feel free to contact Dr. Candice Liss. You can follow us on Twitter. And Arctic Foxy is the website with all of Foxy and Smash's information and beautiful photos. And I was staying to my time perfectly, so I'm finished now.
I'll say it was absolutely perfect. You've been a role model, Dr. Logie, so we'll hold you up as that role model. So thank you to you and to Candice very much for the work that you've been doing and for this presentation. And a number of questions. I want to start with just the link that you described, Dr. Logie, between dating violence and depression, moderate to severe depression in particular. And can you speak to whether that was in terms of whether you were the one that was engaging in that, perpetrating that violence, if I can use that term loosely, or whether you're the one that was on the receiving end of the abuse?
So we included the receiving end. We also did assess both perpetration and victimization, but that analysis is on the receiving end of violence. I
Oh,
have more specific details about that analysis I can send you in the same
yeah,
review. But yeah, it's about having experienced it as somebody perpetrating against you.
right. So I think that a lot of people may not make that connection, which is one of the reasons this work is so important, between food insecurity and a pathway in terms of some of the issues that you were looking at in terms of sexual safety, in terms of condom use, in terms of STI prevention, those kinds of issues. And I'm just wondering, this intervention took place partially through schools. So, do you think that there will be an impact in terms of addressing food in scarcity in terms of the actual school programs, or would you have a recommendation more specifically as to how that might be addressed for youth?
Yeah, I think it's such a great question. A lot of people think that the impact of food insecurity is purely nutritional, and it is nutritional, but it's also a chronic and pervasive stressor that influences so many other aspects of people's lives, especially youth. So, in addition to causing stress, it can also cause shame, and it can produce feelings of inequality and not feeling equal to your peers. I think, and we are working on a policy brief. It would be great, of course, to have school programs. However, what's going to happen if we don't address this at the family level? So people are living in families that are food insecure, right? So even if we were to provide a program of food at schools, which of course that would be wonderful, is it going to benefit the whole family? Because that young person might bring food back from the school program to share with their family, for instance. And also, what are the root causes of food insecurity? And I think that's what we really, really need to think about, especially when we listed that food insecurity was higher with Indigenous communities. So, are we thinking about culturally grounded, strength-based interventions that are sustainable for addressing food insecurity? Are we thinking about policies that make it so that when you buy a platter of vegetables that cost $12 in Toronto, it's $60 in the north, in Nunavut and Northwest Territories? So the cost of food is outrageous, and it doesn't have to be. It could be subsidized. We could find other ways of if we're needing to ship food up there. But I mean, people have been working on food insecurity in the north for a long time. Um, but I guess I'm just raising the alarm that this is like a really, really pervasive issue, and you saw it impacts almost half of the Indigenous youth in our study. So it's an urgent
It's
area that
concerning.
that needs more attention.
It's concerning enough just to think that people don't have enough to eat. That's concerning. But when you understand all the pathways and the interrelationships between other very serious concerns, then I think that that becomes paints a different picture and maybe helps to open doors in terms of advocacy for food security. If you had one wish and you could wave a wand in terms of programming, in terms of anything based on what you found in this study, what would you do? What would be the most needed and perhaps the thing that would have the most impact?
I think what would be wonderful is if Foxy could be more of a repeated presence. You see the benefits when they come once a year, but imagine if there was something that built youth self-esteem, that built peer leadership and confidence skills, and that really also engaged communities in identifying strengths within the community and solutions to issues such as gender-based violence, such as food insecurity. So I think what they're doing is unbelievable and really important. And how can we amplify that and make it a lasting presence, and also to make those connections with policy around mental health resources, for instance. We know that there's insufficient mental health resources everywhere. in Canada and in rural regions. So how do we look at the interconnectedness between dating violence, mental health, food insecurity, and sexual health? So my wish would be that we develop programs that truly look at those interconnectedness of social and health disparities within a context where we're building up strengths and support and resilience and acknowledging all the great things that already exist in cultures and in communities everywhere, and particularly in the North.
Beautifully said. Thank you, Dr. Logie. We're just at the end of our time. It's been a very informative and very important work and presentation. Thank you very much.
Thank you so much for the opportunity to be here with you. Thank you.